Good afternoon. My name is Jim Hoofnagle from Dallas, Texas. If it looks like I'm wearing some of the table decor from last night's dinner, I am. I needed something green, and there's also a possibility that I got engaged last night. We'll see. I've been married for 40 years, but Patty, are you out there? Are we also engaged? Could be. Okay. So, first of all, I'm happy for you to see me. That's not my line. Most of you are too young to remember Justin Wilson. But that's the way he opened every one of his shows. He was a Cajun comedian. I'm happy for you to see me. Reason I'm happy for you to see me is I'm not supposed to be here. In September 2019, I told my primary care doctor, Dr. Khan, guy that I love, I wouldn't be coming in every few months. I'm a healthy guy. And I wished him well. That was September 27th. Yikes. And I'm sorry, this picture is that big. But 2 days later, I turned yellow. I mean, really yellow. I didn't realize how lucky I was that I turned yellow. So that was from a Friday to a Sunday, I think. On Monday, I called Dr. Khan back, and I said, look, I got to come see you. And he goes, okay, smart guy. You know, on Friday you told me to buzz off, and now you want to come in. I said, yeah, I got to see you. I've got a problem. I went in to see him, and he goes, Jim, come here. Called me over to the window, and he goes, my God, you're yellow. I said, yeah, I know. So the next day, he ordered an ultrasound, and within 1 week, I was one of the lucky ones. I had a correct diagnosis for cholangio. And all along this journey that I'll speed through a little bit, I've learned something. And what I learned out of that first episode was never be too sure. One day I was a healthy guy, and I didn't realize what was just around the corner. But not to worry. My gastroenterologist said one of the best guys around is right here in Richardson, Texas. Go see him. That's Dr. R. And he said, Jim, I can fix you. Yes, everything's going to be good. 2 weeks later, and dozens of scans later, he reversed course. He said, I can't help you. So I asked him, you know, what should I be thinking? And he said, you should think of your life in terms of months, not years. Wham. I mean, it was one way, then it was another. So I did go around to Barnes Jewish in St. Louis, to UT Southwestern, Anderson, Harris, and finally chose Anderson for my course of care. Started GemSys right away. Some of you may know that I added THC to that, and this is January 1st of 2020. And later that year I added Abraxane, which may be not a standard of care anymore, but may have helped me. Short story is, I'm lucky. I had a successful resection in August of 2020, and Dr. Song at MD Anderson, some of you may know him, wonderful surgeon, called me and said, Jim, your tumor was completely dead when we removed it. You don't have cancer anymore. So I am happy for you to see me, and what I learned there's always hope. Even though one doctor tells you, think of your life in terms of months, not years, keep going. And you've heard that from other patients and caregivers. Don't take the first answer, just keep going. So after about a year, I felt better, decided I better do something to help out, and became a mentor. I prefer the term traveler to mentor or mentee. To me, mentor, mentee maybe implies that one person is a teacher, the other's the student. And if I found anything out through this journey, is that we start on a path with a colleague, a mentee, and where we end up, you're not going to know. It's a journey, and hopefully you're going to travel with that person. My first try. My first traveler, and He's no longer with us, so I'll use his initials, JS. He lived in the Phoenix area, an energetic guy, always on the go. I could hardly ever track him down for a phone call. I'd catch him in the car in his driveway. He said, "Hey, I'll call you back tomorrow." Never heard from him. When I did get him on the phone, JS had no interest in talking about his disease, his treatment, his diagnosis, how I could help him. He wanted to talk about his trip to Alaska, his trip to the Rockies. And I was just getting frustrated because I couldn't get through to him. So I reached out to my mentor, who was Patty Maxon. It wasn't an official role for Patty, but I said, "Patty, what am I doing wrong? I can't reach this guy. He's not listening to me." And what she said was, "Jim, you're not there to tell him which way to go and what to do. Listen to what his goals are." His goal was to get back to Disneyland with his wife before he died, because that's where they were engaged. I wasn't listening to him. So that's what I learned in my first try at mentoring. I almost quit. But when Patty told me to listen to his goals, it made sense. Listen to what their goals are. That's what I learned. I'll never forget Bill. He was a successful business guy in the Midwest, great family man. I remember when Bill first called me, he was very frustrated. He was diagnosed late, like so many of us are. He was maybe a little bit depressed, and we talked often, probably every 2 or 3 weeks, as he went through the progression of treatments. But each conversation was difficult for him and for me. One Saturday, I'll never forget it, he called me, and it was a different guy. He said, "Jim, I just got back from a retreat, and it was the most revealing thing I've ever done." One of the leaders of this retreat said, "Bill, you've had a wonderful life. You've got a wonderful family. Now, do you want to be remembered as the guy who is frustrated and angry the last year of your life? Or do you want to be remembered as the happy, productive, healthy guy that you were with a beautiful family?" It changed his perspective completely. So what I learned from Bill was, this is more about how you handle your disease and bringing peace to your life than dwelling on your circumstances. I got a letter from Bill's son, Alex, earlier this week, and I wish I had time to have included it, but he went into some great detail about this retreat. And while Bill was frustrated, his biggest frustration was he had just retired and didn't have the time that he wanted with his family and his grandchildren. So that gave me a little bit of a background of why Bill presented as he did. The next person I want to talk about is sitting beside me, Kathy Kimura. Kathy was lucky. Like me, she turned yellow. And we became virtual friends, phone calls and emails about 2 years ago. One thing she said to me after her successful resection was, "When I get well, I want to do what you do." Here she is. Please welcome Kathy Kimura.
That was the lead off. Hi, everyone. I'm so happy to be here with you today. My name's Kathy Kimura, and I live in Hopkinton, Massachusetts with my amazing husband, Alan. We've raised our children, son and daughter, who are out on their own, making us empty nesters. Does anyone know what Hopkinton is known for? Marathon, that's right. It is the start of the Boston Marathon, and Dana Fox, patient yesterday, spoke that he's going to be running the marathon. So on April 21st, tens of thousands of runners from all over the world will converge on Hopkinton to begin the marathon, and we'll be there at the start to cheer Dana on. So in February 2023, I turned yellow due to elevated bilirubin. I was then diagnosed with extrahepatic cholangiocarcinoma in the hilar region. Within the first 2 weeks of diagnosis, I began first-line therapy, durvalumab, with Gem/Cis. Fortunately, durvalumab had been approved 6 months earlier. A huge shout out to AstraZeneca. Because after 3 months of treatment, I had a 60% reduction in tumor size. During my treatment, we wanted to explore surgery as an option. The first surgeon we spoke with deemed me unresectable due to the difficult location of the tumor. While unwilling to accept no for an answer, I wanted to get a second opinion. So we began to look for surgeons skilled in biliary tract cancer surgery. I was blessed to find a very talented and caring surgeon in Boston who agreed to do my surgery in August 2023. At this time, I also changed medical oncologists, and Dr. Olga Kozareva became my doctor. She is an amazing physician, and I can't say enough about her. So my advice is to put together the absolute best team that you can. So 2 months later, October 2023, after surgery, I agreed with Dr. Olga to 1 year of durvalumab with 8 cycles of capecitabine. And since that time, I am now in the monitoring mode with CT scans and blood draws every 3 months. So when I began this journey, I knew nothing about this disease or treatment. Fortunately, the Cholangiocarcinoma Foundation website came up very quickly in my search. I was so impressed with the breadth of information on the website and how current the information was. I read through every menu item, every pull-down tab, and every link, wanting to arm myself with as much good information as possible. Now, on the CCF website, under the Patient and Caregiver heading, there's a community tab where I found the one-on-one mentoring program, Cholangio Connect. And after reading about the program, I thought it could give me a personal experience that wouldn't be available from the medical community or from a website. And it's been an invaluable resource. If you aren't familiar with it, I highly recommend you check it out. So I filled out the patient questionnaire to be matched with a mentor. It's kind of like a dating site for cholangio patients. So shortly after, I was matched with Jim, and within days, I got an email from him, and he became an important person on my care team. Well, I pelted Jim with many questions, and during our calls, he provided many answers. We discussed things like our diagnoses, second opinions, chemo side effects, and surgery. If I asked him something he didn't know, he always called me back later with an answer, and his support and guidance were and still are invaluable. So aside from Jim's help with the disease, I learned from him the best characteristics of being a mentor, things like patience and empathy. He always is open to the topics I want to discuss. But what came as the biggest surprise and what I appreciate the most was this deep human connection that I felt. And it was from this I decided I wanted to share what I could with another person going through a similar situation. So in February 2024, I signed up with the CCF to become a mentor. The foundation provides excellent mentor training. There are many training modules, monthly webinars, and links to helpful websites that cover a wide range of mentoring topics. And after completing training, I was matched with my first mentee, Linda from Mississippi, in April of 2024. I reached out to Linda through email. I was nervous at first that I might say the wrong thing, but that feeling quickly faded. Like me, Linda had many questions. We wrote lists of medical questions for her to ask her medical oncologist and later her surgeon. We also talked about her upcoming procedures and tests and how she was feeling physically and emotionally. Whenever Linda and I speak or text, I try to keep in mind some important mentoring attributes I've learned from Jim and the CCF training. The first is to be mindful of feelings. The tone of every conversation will most likely be different, And some days will be more emotional than others, and you just make an adjustment. To provide education, and if we discuss something I don't know, I can access the deep support system the foundation offers. To be non-judgmental. Everyone has a different approach to their illness, and there's no right or wrong way. Their decisions about treatment are their own. To talk less and listen more. This is probably the hardest for me. But learning how to help the best way is to listen. This discussion should be the mentee's agenda and not the mentor's agenda. 5 is to be open and flexible. Some days Linda and I don't talk about the disease at all. We talk about our hobbies, gardening, food, family, but we always make each other laugh. And 6, to reassure that there's always hope, even if it's just to make today the best day possible. So as a mentor, you're on the giving end and you think the mentee is benefiting the most. But I'd like to say how much Linda has given me. Again, I found the most valuable aspect of the mentor relationship is this deep human connection that's possible when we share something so personal. Although a diagnosis has many negative aspects, you can realize beneficial and transformative changes as well. To have a wonderful mentor in Jim, and now a terrific mentee and friend in Linda, the Cholangio Connect Mentoring Program has been a truly rewarding and vital experience. Thank you. Don't leave you my glasses. Which one do you want to wear?
Thanks. I should have asked at the very beginning, how many patient mentors do we have in here?
Can we have the lights up, please?
Wow, I see a lot. Those are patient mentors, okay. How many caregiver mentors do we have? We need a few more, but that's great. How many people have thought about being a mentor and just haven't taken the first step yet? I see a couple of hands. You know, when I first started, I'm off script. When I first started mentoring, I thought I had to have all the answers. And things change so quickly, nobody can have all the answers. All you need to know, and Kathy alluded to this, is how to listen. And if you don't know the answer to something, where to go to find it. And the foundation is a wonderful resource for all of those things. I've contacted Kim and Cindy and Patty and several others and Melinda several times when I get to a roadblock with one of my travelers. So don't hold back just because you don't think that you know enough. You just have to have the ability to listen and connect with somebody. And following up on my relationship with Kathy, I had no idea as we were talking over the couple of years that I was having any significant impact other than as a mentor and a friend. And I couldn't be any more proud that Kathy's become a mentor, and I'll never forget the day that she told me she was going to. So you never know. My world traveler, and I'll make this quick. Barbara was a retired teacher, volunteered at her theater in Fort Lauderdale. She and her dog Bruiser taught reading classes in the elementary school. I never knew her age, but I'm guessing late 70s, early 80s. And through her treatment, as soon as she'd finish a cycle of something, she'd time her international trips when she had a break from chemo or something. She went to Chile, she went to Costa Rica, she went to the Mediterranean. And it just so happened one time, my wife Lee and I were headed to Portugal at almost the same time. I said, wouldn't it be great, you know, if we could meet up? Because I'd never met her in person. When I tried to reach her a couple of weeks later, I got an email from her son. Barbara passed away in Portugal. But that was doing exactly what she wanted to do. Never keep living your life. That's what I learned from Barbara. Keep living your life. It's not fair. Matt was a 30-year-old fireman from Boston. His diagnosis was not good from the start. He did get a meeting with Dr. Javle, and he was going to Mass General. But Matt left us within about a year. The one thing Matt did get to do was marry his fiancée, Rachel, shortly before he passed. And I learned this, we've all learned this lesson. This disease is just not fair. I thought Matt was maybe unique as a 30-year-old, but we've heard several cases, including Sydney yesterday, even younger than 30. And what's heartbreaking is, you know, I've had my swing. If I passed, but they didn't have a full swing. My Canadian friend, and there are lots of Canadians here, Ranjit was also a successful businessman, wonderful family. Every single time I talked to him, he said, "Do you mind if I put you on speaker? My family's here with me." 2 daughters, a son, and his wife. And no matter when I called or where he was, they were there, at home, at the hospital. Ranjit had a terrible time with blood clots. Every 3 weeks, he was back in the hospital with, not blood clots, blood infections, I'm sorry, with blood infections and sepsis over and over again. He passed, but good things sometimes come out of difficult situations. Both of his daughters have become mentors. And Tia, where are you, Tia? She's here. Tia became a mentor, and so did her sister. Her sister couldn't come for work reasons, but I've been trying to lead Tia around for the last couple of days. She dumped me last night for a group of 30 Canadians, so that's great. I hear they're nice people. This people affects so many people besides the patient. Your family, your extended family, and beyond that. That's one of the many things I learned from Ranjit and his family. The warrior couple, a sailor at heart. Ken lives in cold country. I have never seen a picture of Ken without his wife, Dawn. She is his champion, and together they will stop at nothing to conquer cholangio. He just had his first I'll say it, skip it, you know what I mean, histotripsy treatment about a month ago. And Ken has been a survivor for about 917 days. You know, before cancer, I counted living in years. Since cancer, I count in days. What I've learned from him is that nobody can stop you except yourself, so keep going. My friend Ned. Everybody wants to have a friend Ned. My Ned friend is Jan. Jan, are you here? I have been chasing, did I see a hand go up? Stand up. I've been chasing Jan around here since Tuesday night. Hello. We've been emailing for, I don't know, a year, and until this moment, I've never seen Jan. Don't move. I'm coming to find you. Jan lives in Portland, and she got her Ned card a few months ago. Now, it may have been pulled back a little bit, but she doesn't know this yet, but there's a Ned party at her house on Saturday. So we'll see you in Portland. It's great to have a Ned friend. I'm getting ready to wrap up. Cholangio is why we're here, but there's more. Guys over 40, know your PSA. I was lucky I'd been monitoring mine before cholangio, so I already had an oncologist. My brother-in-law, God love him, was one of those guys that didn't go to the doctor for 30 years. When I beat him up all the time. I said, go, get your PSA. He went. It was 2.4. He said, hey, I'm good. 6 months later, it was almost 4. It was doubling in a hurry. And he was left with no option but a radical prostatectomy. Now, whether he was diagnosed early or not, I don't know. But there's no reason not to know what your PSA is. I don't care how old you are. Everybody over 45, don't wait till you're 50 or 55 like me. Get your colonoscopy. My gastro guy that diagnosed my cholangio said, no problem. Your family history, you're probably fine. I had so many polyps that it took 2 tries to get them all. He said, don't worry, they're probably benign. weekly recalls. If you hadn't gotten to see me, we wouldn't have a 5-year appointment. So if you haven't gotten your colonoscopy, I'm not asking you. I'm telling you. Please, go get it. Thank you very much. I'm happy for you to see me.